Earlier today, I extended Indiana's public health emergency order for another 30 days.
These are not normal times, and we cannot act as if they are.
Now at 10 o'clock, the public health emergency extended through May 3rd. Governor Eric Holcomb also ordering Hoosiers to hunker down for another 2 weeks as the state continues to fight the coronavirus. Good evening, everyone. I'm Brooke Martin.
And I'm Phil Sanchez. Thank you for joining us this evening. The extended stay-at-home order will now last through April 20th. News 8's Julia Deng live at the State House with the very latest. Julia?
Well, Phil, that stay-at-home extension not entirely unexpected after what state health officials call the deadliest 24 hours in Indiana due to COVID-19. Now, all 92 counties in the state are getting ramped up federal support.
Just a word of thanks. The President of the United States, President Trump, has just approved my request.
Hoosier hospitality on display as Governor Eric Holcomb thanked the president for declaring a major disaster in the state of Indiana.
All of our 92 counties.
Federal funding now approved to cover about 75% of every county's COVID fighting efforts and 100% of the National Guard's pandemic-related missions.
We had requested individual assistance also, and the individual assistance piece is still under review.
The state ordering Hoosiers to help each other by staying home longer. The governor's executive order extended by 2 weeks, now set to last through April 20th. State Health Commissioner Dr. Chris Box outlining why compliance is critical, especially in Indiana.
Many of our patients who die of COVID-19 also have multiple underlying medical conditions such as heart disease, lung disease, or diabetes. Unfortunately, Indiana has a higher proportion of individuals who have these conditions as compared to other states.
The infection curve and mortality rate changing daily as state health officials compile and share expanded data.
We are at the start of this surge.
But the numbers top of mind for many tonight are dwindling bank account balances amid record unemployment claims. It comes on the heels of 3 record-breaking years of new job commitments and capital expenditure in Indiana.
Because of our tax and our regulatory
The governor reminding Hoosiers, the sooner we beat COVID-19, the sooner we can get back to work in a state that works.
We were crushing it, economically speaking, and we'll return to that day.
And during the virtual State House briefing, the governor indicated his stay-at-home order could be tweaked come Monday. He did not elaborate on exactly what that may entail. Live downtown, Julia Deng, Wish TV and WishTV.com, and be sure to follow us on Facebook.
All right, Julia, thank you. State health officials confirmed 24 more Hoosier deaths today. That is the most in a single day so far and boosts the state's death toll past a grim milestone of 100. An additional 408 positive cases also brings the state's total to more than 3,400 cases. State health officials say most of the state's deaths have involved people with heart and lung conditions.
Trump announcing the CDC is issuing new guidelines on masks in public places. The CDC has recommended all Americans wear cloth masks. The president said this is voluntary and not mandatory. There isn't much good evidence that masks actually help prevent infection from spreading, except when you put them on the people who are already sick.
From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure.
Meanwhile, State Health Commissioner Dr. Christina Box isn't opposed to Hoosiers wearing masks. Today, she even offered some suggestions on what materials to use.
Cloth masks tend to hold moisture better than other masks, so we oftentimes in medical personnel, we're looking for that moisture wicking barrier that prevents that, from settling into our mask and then being up close to our face. So ideally, if you can have something that has some, something that opposes the moisture getting in, that's what you want to have.
Now, both the president and Dr. Box did stress that people should reserve the N95 or surgical masks for the frontline workers.
Well, social distancing and the stay-at-home orders are having a big effect on Hoosiers' mental health. The state health leaders today revealed alarming numbers. Indiana's 211 service, which helps Hoosiers find local resources they need, has seen a huge jump in calls, from around 1,000 calls a day to 25,000 calls a day, many related to mental health and suicidal thoughts. Addiction hotlines that average 20 calls a week, now averaging that per day. And 2 agencies in Southwest Indiana report a 50% increase in crisis calls. Dr. Jennifer Sullivan, the FSSA secretary, wants Hoosiers to know that help is out there.
Our message to Hoosiers going through this is twofold. 1, it's normal to feel this way. And 2, help, and help that works, is available. If you find yourself experiencing these symptoms, please seek help. You can call 211, you can contact your insurance company to find access to teletherapy, and you can talk to your doctor about whether medication might be right for you during this time.
And Dr. Sullivan had one more startling statistic. Gambling hotlines that average 30 calls a month had 221 calls this week alone.
Well, an entire unit of first responders may have been infected by the coronavirus, and out of caution, they're all in self-quarantine now. IMPD has had 17 officers with confirmed cases. 14 of the city's firefighters were also affected by the virus, but 2 have since returned to work. More cases popping up, and supplies like personal protective equipment running thin.
Every officer has a minimum of 1 to 2 of the N95 masks, and we're looking for alternative ways that perhaps we can re-sanitize those masks and use them again if need be.
The fire department and EMS are both reporting they have had staff test positive and also recover.
Well, concern over the spread of the coronavirus in city and county jails has now risen to a state level. That's why the governor, legislative leaders, and the Chief Justice of Indiana have all signed a letter asking communities to consider releasing some offenders. The letter addresses the limited space in jails and the lack of resources and ability to treat and quarantine infected inmates. It encourages jails to review populations to identify low-risk, non-violent juveniles and inmates that could be released under pretrial, probation, or community corrections supervision.
Well, some doctors and nurses here in Indianapolis have an extra layer of protection from the coronavirus thanks to a doctor from Taiwan and a sheet metal company here in Indianapolis. Wish TV's Dan Klein shows us how they went into overdrive to bring a picture to life.
And it might save some lives, too. The first intubation boxes at Bright Sheet Metal here on the northwest side went out Friday afternoon. They could have far-reaching effects for those in the front lines. To be honest, it doesn't look like much. A simple box. 2 sides of metal, 4 handles, 2 sides of plexiglass with 2 holes.
Your doctor would reach his arms to here.
But for doctors and nurses around the highly contagious coronavirus each and every day, it's a simple intubation box that may keep them from quarantine.
If it provides that extra protection, that's what everybody wants. Everybody wants to be safe.
And it all started exactly 1 week ago with these photos from a doctor in Taiwan and a news article. Employees at Community Health Network asked if Gary Aletto and his Bright Sheet Metal company could replicate it last Friday. They actually improved it, shrinking its size, adding the handles, turning to metal so it was a little more sturdy. By Monday, they had a prototype. By Wednesday, doctors offered a few more tweaks. And now, Friday, 12 are already off the production line and at Community Health, with more health groups looking Friday afternoon.
Everybody's trying to pitch in where they can right now. I think we're all kind of scrambling to help the healthcare group out wherever we can. So every little bit helps.
A contractor known for ductwork, including the system at Lucas Oil Stadium, doing something a little different. And that's not all. They just sold 50 partitions for desks at the hospital on Friday, too. The boxes aren't cheap. Surgical-grade stainless steel, plexiglass, which is suddenly in high demand. Just the cost for materials, about $350 per box.
I think it will make a difference. I think it's just added protection for the doctors. This will just provide an extra layer of protection for them.
Protection that's just about priceless these days. But don't think it's perfect. They're ready to adjust again on doctors' orders. And it shouldn't take long.
We'll be getting some feedback from them, and maybe we'll have to tweak the design again.
As for the sale price, that's still being worked out. But Bright Sheet Metals has bought enough material to be able to make 200 more intubation boxes by Friday. Reporting in Indianapolis, Dan Klein, Wish TV, wishtv.com, and be sure to follow us on Facebook.
Dan, thank you very much.